Hey everybody, my name is Rob Drenning, physical therapist. In this video, I'm going to show you a quick hitter instant pain relief technique that you can use to get rid of that stubborn pain with tennis elbow or pain on the outside part of your elbow. This technique works great if you're like a lot of people who struggle with pain with gripping or twisting, or anytime you have to lift or make a strong sort of grip. This technique can be very effective for you. Opening jars, all of those things are something that can be very limiting when your elbow's bugging you, and this is one that can really help. So there are two parts to any injury. The first part is addressing the source of pain. That's what I'm going to show you now. It's the tendons on the elbow. This is what will give you that instant relief. But the second part is addressing the underlying root cause that's making that thing painful in the first place. And with the elbow, I'll just spoil it for you, it's not the elbow. It's places around the elbow that are making these tendons work too hard and making them painful. In another video, I went through different exercises you can do to address underlying causes of tennis elbow. So make sure to check that out for long-term relief. This technique now will give you relief today, right away, but the underlying causes are what will give you relief tomorrow, 6 months from now, a year from now. And that's what you really want. So those two things are equally as important. So make sure you're doing both. But everybody wants pain relief today. So this technique is really valuable for a lot of people. So let me show you that right now. So what we're going to do is first I'm going to use a towel, just something to squeeze, something to grip. And what I'm going to do is I'm going to straighten my arm and I'm going to squeeze, and I'm going to take note of how much pressure I can put in the towel, how painful it feels. That's your baseline. When we do this technique, we want full or near full relief right away. And then afterwards, we're going to retest it again and see if we can get more pressure, or we feel like we can get more pressure. So what you want to do is you want to find the edge of a wall or something like that right here. And then you're going to take the bone on the outside part of your elbow, usually right around the spot where it's very painful, and you're going to put it about an inch past that edge of the wall. So if I drew a line from that bone, it'd be about an inch past the wall. I'm going to hold the towel with my palm down. Then I'm going to take the web space on my other hand. I'm going to find the bone on the inside part of my elbow. For me, it's easy to see because I'm super bony, so it's right there. And I'm going to go about an inch below that, and I'm going to put pressure right there. And I'm going to have my forearm parallel to the floor as I'm putting that pressure. And what I'm going to do is I'm going to put pressure on my forearm, and I'm going to squeeze the towel. And the more pressure you can get, the better. Some people like to really lean their body into it. Push and squeeze the towel. And we want to do 10 squeezes, and we're going to do 3 sets of 10. For those 10 squeezes, you can either push, do the 10 squeezes while you hold that pressure, or some people prefer to push, squeeze the towel, push, squeeze the towel. Usually, if you find that pressure that's pain-free, just hold it and do 10 grips. Maintain that pressure. Once you've got it, just keep it. Sometimes it's hard to refine. Now, if it's not painful right away, don't give up. Just adjust the angle of your arm a little bit. So oftentimes dropping your elbow and pushing, angling a little more up can be helpful for a lot of people. So you drop down, you push, and squeeze that towel. Again, the more pressure you can get, the better. I like to just hold it and do my 10 squeezes and then rest. And I would do that for a total of 3 sets. 3 sets of 10, 2 to 3 times a day is sort of what you're shooting for. This can be a very helpful technique, not for every single person with tennis elbow. If this doesn't help, don't worry, there are other things that can help. But even if it does, we still have to address, remember, the underlying causes. This will get it away right now. The causes are what will give you long-term relief. After you do this, you're going to retest, do your grip again. See if you feel like it's better. If you can, you know this is going to be an effective thing for you to treat. But now you need to go check out that video addressing the underlying causes to get that full long-term relief.